Everyone, and welcome to the first in the series of the Conceive Baby Fertility webinar series. My name's Tasha Jennings. I'm the founder of Conceive Baby. And for those of you who don't know me, I'm a naturopath and nutritionist and have been for the past 15 years. My background is in clinical practice, as well as product and program development, teaching and training, and writing and presenting. I've written and provided expert comment for major media publications such as the Herald Sun, The Age, The New Idea, Mouth of Mums, Cosmo Pregnancy, the Bub Hub, and other parenting and pregnancy websites, as well as medical and pharmaceutical journals. And in my previous role, I also appeared on the morning shows, the David and Kim morning show, the Kerry Ann morning show, and I was a keynote speaker at the Pregnancy and Babies Expo. I'm also an author. My first book, The Vitamins Guide, was published in 2013, and that's available throughout Australia, the UK, Canada, and the US, and also, of course, on the Conceive Baby web shop. And my second book, The Fertility Diet, was just released in July last year. And the fertility diet is really where my personal passion lies. For the past 5 years, I've been specialising in fertility and pregnancy. And my reason for specialising in this area, I guess initially was a selfish one. I was wanting to fall pregnant and we were having difficulty. So I guess what started out as a small personal project to help us fall pregnant really turned into a career passion as I met with researchers both here and internationally, and was really inspired by what I was discovering about the role of certain nutrients and their bioavailability on fertility, as well as the long-term health of the developing baby. And this is how my company Zycia was born. Now, Zycia means life and specialises in supporting and promoting life in its earlier stages. And Zycia Natal Nutrients is the premium nutritional supplement that's been specifically designed to support that journey from fertility and preconception right through to pregnancy and breastfeeding. And more recently, to further support people in that journey through fertility to get to pregnancy, I introduced the Conceive Baby website, which is what you see today. Again, this was based on my personal fertility journey. I guess I was lucky enough to have a background in health and nutrition. And with my husband being a cardiologist, we were fortunate enough to, I guess, have access to not only the knowledge, but also the contacts that meant that our fertility journey was relatively short compared to most couples that I speak with. So my aim with Conceive Baby was really to give other couples that are struggling, like myself, access to the expert advice and contacts that we were fortunate enough to have that enabled us to conceive and carry our two beautiful children, photos of whom you will see scattered around the Conceive Baby website, including the big feature baby photo, which is my gorgeous son, Jonah. So as a part of that valued expert panel, is Dr Amanda Waaldyk. Now, Amanda is a renowned doctor of Chinese medicine. She's worked and studied internationally with some of the best fertility specialists in both Chinese medicine and in yoga. And she's the founder of Angea Acupuncture and Yoga, which specialises in fertility and helping couples achieve their dream of pregnancy. Now, Amanda is also a proud mum to two gorgeous children who are actually a very similar age to my own, we have now discovered. So I just want to thank everyone, thank Amanda on behalf of myself and everyone who's here today for taking the time out of her very, very busy schedule to be here today. So welcome, Amanda.
Thank you. Thanks for having me. I'm really excited to be here today.
Oh, I'm glad to have you. So now, first of all, I guess I've mentioned a bit about my journey. What, made you specialise in fertility?
Well, interestingly enough, when I first started my business, I was seeing lots of sports medicine after coming back from China. And so then, funnily enough, women just kept appearing at my doorstep. And I was like, okay, there's something that I need to listen to this, basically. And so from there, the business has just grown, and it's a deep, deep passion of mine. Angea actually stands for Fertility Goddess. And essentially what happens is that she takes it's Aboriginal mythology for Fertility Goddess. And so what she does is she takes away the souls and she plants them into the earth in this beautiful cone-like structure. And then when the mothers are ready, she takes them out and she plants them into the womb. And so essentially what we do at the clinic is we facilitate that journey through acupuncture, through meditation, through mindfulness, and also through yoga. And also too, so I had struggled with my own fertility journey. When I'd met my partner, Garth, we started trying, and I had a blighted ovum, and I found this out at 9 weeks, and following that blighted ovum, I had to have a D&C. So, and then just knowing what I know through immunology and whatnot, I was really really frightened me because I do know the effects of what this can mean, and it may have meant that I had to go down the IVF path, which I was totally fine with as well. So we did a lot of preconception care, and that I spent a year on that preconception care through nutrition and through yoga, mindfulness, also through diet, and made a whole heap of changes. Even though I have a relatively clean lifestyle anyway, there was still things that needed tweaking. And then fell pregnant with Winnie, and then after Winnie had a miscarriage, and then conceived Freddie. So, it's just this journey, it is so challenging on so many aspects. And I know for the people that are here today, whether you are going through your own challenges, that it's great that we can have access to all these professionals to be able to learn more about our own fertility, because there's so much information out there, and I think sometimes we get overwhelmed and we don't know which direction to go. So it's great that we can be able to support you and facilitate you.
Thanks so much. I totally agree with you with Google. I think it's almost an enticingly evil place sometimes. I think there's so much information out there that you think, wow, this is my saviour. But yes, there's so much conflicting information and advice that you really don't know who to trust. So thanks for coming on board and really supporting Conceive Baby and creating that expert panel that we really want to develop, that people can trust and know they're speaking to experts. So today we were specifically talking about acupuncture, which I know is a particular specialty of yours.
Yes.
And I guess in my background, I know a bit about acupuncture as well, but it does, it is still a myth to me. Like, what is acupuncture? How does it work? Yeah, I guess if you can explain more would be great, and how it helps us in fertility.
Absolutely. I mean, it is quite mystical. It's only now that we've been able to have evidence-based research that acupuncture supports fertility, and we know now that it's becoming very much mainstream. Monash IVF, Melbourne IVF, City Fertility, they're all using acupuncture for pre and post transfers. So acupuncture is essentially the insertion of fine needles into the skin, and what it does is it stimulates acupressure points or acupuncture points, and as we trigger these acupuncture points, they create a healing effect into the body, and this works on our hormonal system, our cardiovascular system, our digestive system, and essentially it facilitates homeostasis. So what we're trying to do is reach balance in the body, and when the body is balanced, that's when things function properly, they function correctly. So Essentially, yeah, Chinese medicine philosophy is based on yin and yang, which is, it comes back to a balance. It's on male and female energy, and it is essentially relates to homeostasis.
Yeah, that's a good thing about balance in fertility.
I mean, this is the thing, right? I find it really hard to be able to sometimes translate the Eastern to the Western. And I think that's where a lot of people don't really understand what acupuncture is, because there is that sort of, not blockage, but it's that misinterpretation from Eastern to Western. And so what it does is it initiates the relaxation response in the body. And so, as we know from our busy lifestyles that we lead today, we are in this flight or fight response known as the sympathetic dominant system. And so acupuncture has the ability to tap into the parasympathetic dominance, and that is in the rest and digest state. And when the body is in the rest and digest state, that is when the healing can start to take place. And it also allows the body to start healing on a physical level, a mental level, and an emotional level. And it's the same with yoga. It's that same sort of philosophy. We're trying to initiate the relaxation response, taking the body into that parasympathetic dominance so the body can begin to heal.
Now, also, obviously, there's certain points that you do use in fertility with when you're using acupuncture. What's the relevance of the particular acupressure or acupuncture points and why they're used?
So we use specific points that work on it's similar to the chakra system in yoga. So we work on points that stimulate the hypothalamus. And as we know, the hypothalamus is like the middleman. What we perceive and see every day is relayed into our internal environment. So can I just turn my mail off? I just realized I have my mail on. Sorry, guys. So what we do essentially is if we're stressed, that's being relayed into our hypothalamus, which is then sent to our pituitary gland and then sent down through our ovaries or through our adrenals, through that HPO axis or the HPA axis. And so what we want to do is we want to allow the body to be in that relaxed state, so then that feedback system for our hormones can start to function optimally. Because we know that when we're stressed, we can start to have irregular cycles. We know that when the stress hormone, we release cortisol, and this can then suppress the immune system. And so then it's like we have this cascade effect. And we know, particularly for females, because we are so hormonally based, aren't we, that we know when we're out of balance. You know, leading up to our period, we may have PMS. You know, there's all these little signs and symptoms that our body indicate to us that when we're out of balance. And so acupuncture helps to reestablish that feedback system for our hormones, and working on to create a really fertile body.
Because it also helps with blood flow and uterine lining and uterine health. I think that's why they use it, obviously, in IVF. Are there certain areas that you work on? I mean, does it work on just the hypothalamus and through the whole body, or there are particular areas that you would say focus on for a woman? Would you focus mainly around her uterine area, or do you focus on the whole body, or I guess it's a bit dependent on the person?
No, that's a great question. Specifically at the clinic, we focus on the 4 phases of your menstrual cycle. So we'll focus on menstruation to create a really healthy menstrual flow. So we'll do lots of acupuncture points through the lower abdomen, focusing on the uterus. Essentially, in Chinese medicine, we want you to have a healthy flow. So that means that the blood empties completely. And so then we work on the follicular phase, so helping to grow a dominant follicle. So here we work on specific points that trigger the FSH hormone, the follicle stimulating hormone, and then we work on points that stimulate blood flow to the ovaries as well. And then also that focus on the endometrial lining, because essentially we want to create a really healthy blood flow to the endometrial lining and to the follicles to grow. So in Chinese medicine, I just use the philosophy of watering your garden. And we also use moxa as well, which creates a really healthy vascular flow. And this also works on improving egg quality, particularly for women that are of reproductive age, 40 years and over. The research that's come out of America indicates that moxa is really amazing for improving overall egg quality. And we've seen these results in the clinic as well. And then we work on ovulation, and we work on stimulating the ovary, to the dominant follicle, to release that egg. And here we do specific points also through the lower abdomen. There's points called zigong, and in Chinese medicine this translates to the women's palace or to the uterus. So essentially what we're trying to do is we're trying to create this beautiful healthy garden, so the women's palace can house your babies. So there's this beautiful sort of like poetic side, because I do kind of incorporate the spiritual side as well. In Chinese medicine, the points that we use from the hypothalamus or do 20 into yin tang, which is also works on the pineal gland, into the heart center. You know, it's all about our heart's desire. And so opening up our heart to allow the joy to flow back in, because as we know through this journey, we can get stuck in our emotions. And particularly if we're doing IVF and we've had failed cycles, we want to open up this heart space. And then we work on points down through, and in Chinese medicine, it's called the conception vessel. So we're working on points down the conception vessel into your beautiful women's palace. So this is kind of like the philosophy that we use at Angea. And then, of course, we do points that support the luteal phase. So supporting that corpus luteum function, allowing the body to produce enough progesterone to be able to support a pregnancy. And then if there is conception, then we do points to be able to support that next stage of embryonic development, and then also to be able to support the mother. And we do points, a lot of points on the head, and the research indicates that it's a holding. And what this holding does is it reduces the chances of miscarriage. But then also too in the clinic we incorporate a lot of Western medicine as well, with hormonal tests, understanding like what the different hormones need to be at the first stages of your cycle compared to the second stages, between your progesterone and your FSH levels. So there's all these different factors that are contributing to creating a fertile body and getting the hormones into balance.
I love that philosophy. That's really beautiful that you can incorporate that into the whole fertility journey as well. And I know people often ask me, you know, when should I start, you know, getting help with nutrition? When should I start? I mean, I know there's the 90-day obviously life cycle of the egg when the follicle's developing. Is there a certain time frame that is ideal, or I guess it obviously is variable depending on pre-existing conditions, etc. But when should people start looking into acupuncture, I guess?
I think it's a personal choice, as we know on this journey. And I think the sooner you start, the greater your chances are of conception. And also too, I mean, it's really an investigative process as well that we use at the clinic. It's really kind of stopping and looking at everyone's understanding of their whole fertility journey, perhaps of why they haven't been conceiving. But essentially, I would say to ladies to have a look into it, to start now, because it really does contribute to that whole preconception care. And then also too, bringing balance back into your hormones, that we can start straight away.
Do you treat people who are already taking the pill? I know I've had people come to me and say, I don't want to stop the pill. I'm thinking about, you know, having a baby in 12 months' time, and I'm really keen, and I'm, you know, I love those people, mind you. You know, I really want to start getting my body ready. Would you treat people alongside the pill, or would you treat them closer to their, I guess, trying to conceive?
I mean, that's a really great question, Tasha. It's a mixed school of thoughts there. It just depends. If they're wanting to come in, then we can definitely treat them. We can work alongside them, as you were talking about, with nutrition, and then also working on egg quality. There's other things that we can do, such as moxa, Chinese herbs. But as we know, the pill essentially shuts down the hormonal system. And so for some ladies, I say, you know what? Why don't we look at a preconception care program through nutrition, through Chinese herbs, and then when you're ready to come off the pill, then come back in and see us.
Yep. Sounds excellent. And I know you also, I mean, we talked about a lot about women here, and I guess from our own experience, we know what we've been through, but you also look at sperm health, and there's obviously been a lot of research around sperm health in acupuncture as well. What do you do differently with males?
Okay, so with males, of course, we always get them to do a semen analysis first, so then we can understand what's happening with their quality and quantity and morphology of sperm. And then we do specific acupuncture points that work on and research has been conducted around this that improves their overall quality, morphology and quantity. And then we also use a combination of supplements and Chinese herbs. As we know, it takes two to tango, so we need to. The males also need to be on board as much as the females, and we do know through research today that it's 50% of males are also affected by male infertility.
So would you ideally work with both male and the female? I know that was always my preference. So you see both males infertilities in both the male and the female couple during the
do you know, believe it or not, 99% of women at the clinic, 99% at the clinic are women. We have probably about 1% of males. So what I do is I always get the wife or the partner to bring in their husband's semen analysis. And then I have a look at it, and then we discuss it, and then we say, look, if they want to come in, they're more than welcome to. These are the things that we can treat. But I don't think the males are as proactive as the females, to be honest. I really find that the women really take hold of this, and they do as much as they possibly can to increase their chances. There's a lot to be left said about the males.
Absolutely. Look, I agree with you. And I think the people on Conceive Baby, probably the people listening today, are 90, if not 100% female, who will go home and talk to their partners about it. But as you said, they are 50% of this journey, and they shouldn't be discounted.
Absolutely, yes. Boys, they need to be involved just as much as we do.
Yes. And are there any things that I guess people can do themselves? I know I used to use acupressure. I know it's really something mild, but even in pregnancy, I had that lovely nausea acupressure point, and I don't even know how it works, but it worked. Are there acupressure points that people can use themselves, or would it always be involve needles?
No, there's definitely acupressure points. What we'll do at the end is I'll send you through a sheet with acupressure points that they can use at different parts of their cycles. There's some points on the hands, there's some points on the feet, there's some points on the legs. So there's a couple of points that they can use to help detox their liver, a couple of points to help reduce stress, also some points to be able to calm the mind. And then we can I'll be able to show them some points as well for the abdomen, which they can work on stimulating their ovaries as well. So that can be done during the second stages of their cycle. I generally, sorry.
Oh, yeah, no, you go ahead.
Yeah, so I'll send you through that form, and then you can send it through to the listeners.
Excellent. Look, that's great. If anyone wants to hang on at the end, we'll make sure that we've got everyone's details, and we'll send you that link. Is there anything you'd like to leave everyone with today who may be, from the feedback we've been getting through our survey there, most people who are listening today are anywhere from trying for 3 to 6 months to 18 months and 2 years plus. Is there anything you'd like to say to people about acupuncture and where they should seek more the next step, I guess?
I guess for some people, I think if it's something that you haven't explored and you've been on this journey for a little while, it's definitely something to start exploring. We see a lot of patients. It's kind of, sometimes we find that it's a last resort, is that people have tried absolutely everything, and they're like, okay, well, I haven't tried acupuncture, I'm going to give acupuncture a go, and then they have success through that. I think it's also too, it's really going to see your GP and having a discussion with your GP or an integrative practitioner, and then really understanding your fertility, so understanding what your hormones are doing, really taking a look at your diet. It's kind of like, okay, how can you peel away the layers and get a really clear picture of exactly what it is that's happening for you and your fertility. And so this is what we do at the clinic, is we educate our patients through this journey. We get them to do blood tests. We get them to have a pelvic ultrasound. So we've got a real process that takes them through, and then we get them to do charting as well. So some people might be interested in charting. doing their basal temps. And if they're not pregnant generally within 3 to 6 months, then we say, okay, and everything, all the blood tests have come back normal, all their hormones are in balance, their pelvic ultrasound looks good, then we say, okay, maybe we need to see a fertility specialist. And then they can book in with the fertility specialist, because sometimes it can be, you know, immunology, it can be ANA, we look at thyroid. So there's all these different contributing factors, and today we're seeing so much more of an increase in these factors. So yeah, it's really getting an understanding of your fertility, and get on the bone broth.
Yes.
I can't stress that enough.
Yeah, I grew that up with kids, actually. Excellent stuff.
And so that's all. Yeah, that's about it, I think.
Oh,
You got any more questions? Does anyone have any questions?
Look, I think you covered the most points from what I can see popping up here. So I think that's thanks so much for being here today. It's just wonderful to hear, I guess, your holistic view of fertility, and that's really what Conceive Baby is all about. I think taking one channel on its own, I think we're all working towards the same end. I know as a naturopath, people often said to me, how are you married to a cardiologist? You know, don't you supposed to hate each other? Aren't doctors supposed to hate naturopaths and Chinese medicine and vice versa? And I just think that's such an antiquated model. We're all working towards the same end, and
That's right.
It's wonderful to see the fertility specialists, the Chinese medical specialists, the fertility psychologists, you know, the wellness chef, all the experts that we do have on board that are so inclusive, and we can all support each other and support, you know, the couple via different aspects of that
We're all
fertility.
trying to reach the same goal, isn't it? And it's beautiful that we can have this integrative approach now.
Absolutely, because you really need all of it. As my husband often says, I mean, he would rather treat people with magnesium and CoQ10, which he does, than see them on his operating table, and vice versa. I'm not going to try and give someone nutrition if they've just had a heart attack. So I think we really need both modalities, and if we can all work together, we can, you know, achieve a much better result for couples. So thanks everyone for being here today. I'll just wrap up now, and obviously the people who have registered, we do have your details, so we'll be sending you the wonderful advice that Amanda has just said that she will give out. The notes will be coming to you. We'll also be, this is obviously the first in the webinar series, and I was just saying to Amanda, I've been inundated really with interest from specialists, so we're actually booked through until March next year. I'll be releasing the schedule very soon, but our next webinar will be by Rebecca Winkler, who is a beautiful naturopath specialising in fertility out near Janjuk, a beautiful part of the world near Bells Beach, lucky thing. She'll be joining us at 12:30 on next Wednesday, the 26th. Then coming up, we'll have Tony Chiodo. I love him. He has fabulous recipe books. He's appeared on SBS, and his recipes have been in Vogue magazine. He's really about treating the whole person, and through nourishing food and really understanding your body and treating your body with the respect it deserves through your nutrition. We also have Dr. Alex Polikov, who is a fertility specialist, and he will be coming on board on the 22nd of November. And there will be more to come. I'm still announcing dates as we speak, so keep looking on the Conceive Baby website. And if you haven't checked out our directory, make sure you do, because that's where you can get access to direct support in your local area to specialists who are on our directory. And, of course, join our mailing list and keep your eyes peeled. I look forward to seeing you at the next one.